Greetings. I'm Dr. Christopher Roby, the Chief Operating Officer with the Community Health Centers Association of Mississippi. I'm here with Aspen Hardges, who serves as Assistant Director for Social Services at Samurai Health Center. And so, Aspen, thank you so much for sitting with us. I want to start out by asking you about how has this conference been? This year we have over 399 participants, close to 400 people here. How has this networking opportunity been for you this year?
First and foremost, I am a social worker, a licensed clinical social worker, and I just left a session, and I am just so impressed by the information that they provided. We talked about doulas, and not only did we talk about doulas just being for individuals personally, but also bringing that, incorporating that into our community health centers. Just hearing informations about different entities in the community of how they help others, it allows me to grow as a social worker, but also allows me to bring that information to our clinics because we can provide these services possibly one day for our clients.
Awesome. And so as we think about it, I know a lot of your work deals with a lot of HIV. As we focus on the challenges that's impacting our health centers and trying to build the strengthening, going back to our conference theme, strengthening our roots.
Right.
How do you think the work that you do, what can we do to strengthen those roots for our community health centers?
First and foremost, I want to keep it professional, but I have a lot of concerns as related to the clients in which we serve. First and foremost, we have Hispanic clients who have informed me that they are concerned about coming now for treatment just because of the climate and what's happening and how the rules are changing. So for me, one of the things that I definitely want to express is that our funding to manage the care of people living with HIV, but also HIV prevention is needed. And so cutting those programs could really mean people falling out of care. And so that's going to contribute to new diagnoses and other health concerns.
Awesome. And I want to end it on a really high note. Tell us some things that you want to see next year for our annual conference, some of the sessions you think would be great for conference participants to hear.
First and foremost, you guys already do a phenomenal job.
Awesome.
Things that I don't even think about, you are definitely bringing here. One of the things that I think that is very important, I know that you always talk about self-care, but also for our providers, I think that it's good for them to come in just so they can learn and grow on how to take care of all people. Just because you're prescribing certain medications doesn't mean that our community will take it just because of past history. And so I think that it would be great for leadership to be a part of and have a lot more information about the importances of not just keeping sessions 15 minutes. Sometimes they might need to be 30 minutes if you have clients that have a lot of health concerns. So I think just really reaching out to our leadership, but also our clinicians would be great.
Awesome. Well, again, Aspen, thank you so much for taking time out with us, and we look forward to seeing you at the 39th annual conference back here at the Beau Rivage.
I shall be here. Thank you.